You're given a blood test. You have 10 seconds. Can you interpret it correctly in English? Because in real clinical settings, there's no time to hesitate. This is where knowledge becomes decision. Let's train that. Section 1. Systematic Approach to HBC. Interpreting a blood test requires a clear and structured method. Each parameter gives a clue, but only if analyzed in the right order. Step 1. Hemoglobin. Start with hemoglobin. Ask, is it normal or reduced? If it is low, this suggests anemia. This is usually the first indicator of an underlying problem. Step 2. Red cell indices, MCV. Next, consider the MCV, the size of red blood cells. Low MCV suggests iron deficiency. High MCV suggests vitamin B12 or folate deficiency. This helps classify the type of anemia. Step 3. White cell count. Now, assess the white cell count. Elevated levels suggest infection or inflammation. Reduced levels may indicate bone marrow suppression or dysfunction. This reflects the body's immune response. Step 4. Platelets. Finally, evaluate platelet count. Low platelets indicate increased bleeding risk. High platelets may be associated with inflammation or other conditions. This parameter is closely linked to clotting function. Once the structure is clear, the next step is to apply it to clinical scenarios. Section 2. Case-based interpretation. Each case combines symptoms and laboratory findings. The goal is to connect both clearly. Case 1. Patient presents with fatigue, pallor. Lab findings: low hemoglobin, low MCV. This is consistent with iron deficiency anemia. Low hemoglobin with low MCV strongly supports this diagnosis. Case 2. Patient presentation: tingling sensation, weakness. Lab findings: low hemoglobin, high MCV. This is suggestive of B12 deficiency. Neurological symptoms reinforce this conclusion. Case 3. Patient presentation: fever. Lab findings: elevated white cell count. This indicates an infection or inflammatory process. The laboratory findings support the clinical picture. Case 4. Patient presentation: easy bruising. Lab findings: low platelets. Interpretation phrase: this suggests thrombocytopenia and increased bleeding risk. This finding explains the patient's symptoms. Section 3. Practice: high value. Exercise 1. MCQs Clinical Decision. Question 1. A patient presents with fatigue and pallor. Lab: low HB, low MCV. What is the most likely diagnosis? A. B12 deficiency. B. Iron deficiency anemia. C. Infection. Your answer? Yes, B. Iron deficiency anemia. Microcytic anemia is most commonly due to iron deficiency. Question 2. A patient has neurological symptoms. Lab: low HB, high MCV. A. Iron deficiency. B. B12 deficiency. C. Thrombocytopenia. Answer? Absolutely. B. B12 deficiency. Macrocytosis with neurological signs suggests B12 deficiency. Question 3. Which parameter is most associated with infection? A. Platelets. B. White blood cells. C. Hemoglobin. How would you answer? Excellent. B. White blood cells. WBC count reflects immune activity. Question 4. Low platelets are most associated with A. Oxygen transport. B. Bleeding risk. C. Hormone imbalance. Answer? Right. B. Bleeding risk. Platelets are essential for clotting. Clinical language. Upgrade. Say it like a doctor. Situation 1. HB is low. Say, hemoglobin is reduced. Situation 2. Results show anemia. Say, the findings suggest anemia. Situation 3. Infection is likely. Say, this is consistent with infection. That's it. Watch again. Repeat out loud. Own it for your clinical communication. Follow for more Medical English Pro.